According to President Biden, the nation's COVID-19 national emergency is over. He signed an order last week ending federal funding for testings, vaccines, and other pandemic measures.
That's separate from the public health emergency that's still in effect but set to expire in May. Camila Williams talked with Georgians about what that means for those insured and uninsured.
No more at-home COVID tests, and the COVID vaccine will soon cost if you're uninsured or on traditional Medicare. Mary Cargile says families on a budget will see the impact.
Some people just not going to have the money to pay for it.
Cargile has friends who are on Medicare and Medicaid. She says it's sad that they may lose those benefits too.
That's a bad situation because even if they have to reapply and they don't get approved, then how are they going to pay for, things that they need, especially care?
With the public health emergency ending, Kaiser Family Foundation estimates between 5 and 14 million people will lose Medicaid coverage. Nancy White with the Macon Volunteer Clinic wants to come to the rescue.
We are concerned that many people that recertify for Medicaid as a result may find themselves no longer eligible, and so we stand by ready to care for them if they're eligible for our services, which are free if you are.
Kaiser says if you are uninsured, a COVID vaccine will cost almost $130 a dose. White says even getting COVID test kits may be different for their office.
Piedmont Health here in Macon made available 1,000 to us to provide for our patients and our volunteers. So when that ends and they're not free anymore, it will be a challenge.
Cargile hopes people will still remain cautious.
And still wear, masks and still protect ourselves because COVID ain't going nowhere.
In Macon, Camila Williams, 13 WMAZ News.
There are currently 2.7 million Medicaid and Peach Care for Kids members in Georgia.
We're taking a closer look at how to make sure you know about the changes and breaking down vaccine progress in Georgia. Georgia's Health and Human Services Department advises Medicaid recipients to update their Gateway account with accurate contact information. They also say to check staycovered.ga.gov for important news and resources. The Centers for Disease Control and Prevention says 69% of Georgia's population has received at least one dose of a COVID-19 vaccine.
That's more than 7 million people. 57% or more than 6 million people are considered fully vaccinated. Less than 1% of the state's population has received a booster dose. 28 million doses of the vaccine have been delivered, with 17 million administered.